The cost of cancer care is growing 15% a year. It's expected to top $175 billion in the United States by the end of this decade. Costly cancer drugs, one reason. But a new study out tonight from the insurer United Health Group finds there are other ways providers can cut costs dramatically. Bertha Coombs has more.
The study aimed to cut costs by removing the profit motive to order costly procedures and higher-priced drugs.
We froze the profit margin that a doctor could make on chemotherapy medications, and we thought that would actually reduce the amount of high-cost drugs that were being used.
United Health worked with 5 cancer centers over 3 years, including Northwest Georgia Oncology, giving them a fixed fee for each patient.
And we showed them all the things that were happening in their practices, their use of medications, the hospitalizations, use of diagnostics.
They cut costs, but the end result was a surprise.
Even though we lost the battle, so to speak, in terms of controlling the drug costs, we won the war in terms of controlling the global costs of care.
They'd estimated drug costs at $7.5 million. The actual costs, $21 million. But they were more than offset by lower medical costs for high-priced hospitalizations and radiation. The estimated tab under a normal contract, nearly $100 million. Under the pilot program, costs were 1/3 lower, with no change in the outcomes for the cancer patients.
And their survival was exactly the same as our national averages in fee-for-service. So quality is not taking a hit.
Dr. Bruce Gould credits the change to sharing data.
Being able to put numbers to those different aspects of costs makes me more thoughtful in terms of how I use those resources.
One way he cut down on costs, hiring a physician's assistant to coordinate the hospital care of his office's patients.
And they would end up spending an extra night in the hospital and being discharged the next morning. With a full-time physician's assistant over in the hospital, the patient could be discharged that day.
But all of that coordination cost the practice money, which Dr. Gould hopes they'll make up by sharing in the savings from the program. At a time when Medicare and other insurers are cutting reimbursement, he says doctors have to play a more central role in trying to corral cancer costs without sacrificing patient care. Bertha Coombs, Nightly Business Report.